Acupuncture is becoming more popular with physicians around the country, but is it the right treatment for you? Here's more with Dr. Suzanne Swearingen. The most common side effects of acupuncture treatment are things that everyone wants, like better sleep, more energy, better digestion, and less stress. But sometimes there are some side effects that you need to be aware of. Back with us now to explain is Dr. Suzanne Swearingen with Alternative Health Clinic. Good to have you back.
Thank you.
Okay, so doctor, let's talk about some of those negative side effects. What are they and when do folks kind of typically start to see them?
Generally, they'll occur within the first 12 to 24 hours. The most severe is going to be in a case of pain where you might feel a worsening of the pain in that 12 to 24 hours. The good news is when that passes, people generally feel better than they have in weeks or months. So it's a good sign. Some others would be a little bit of localized bruising where a needle might have been, usually goes away within a couple of days. Another one is maybe feeling a little mellow for the rest of the day, but generally that's followed again by a burst of energy, feeling better. It'll never interfere with anybody's abilities to do their daily activities.
Sure. Okay, and one thing we were talking about before was the needle. I was asking about, is there ever bleeding at all associated with it? And you said no, but kind of explain a little bit about that needle.
Well, the needle is very fine, so it's about the thickness of a whisker. That's a pretty fair comparison. And sometimes there might be a little bit of bleeding, like a drop, but nothing severe. Even people on blood thinners, not really a problem. So they're just very fine needles. They're there to stimulate, not penetrate.
Okay, and so for these negative side effects, how common are they?
Oh gosh, maybe, less than 10% of people deal with that.
So that's good. And another interesting thing we were just talking about is the type of clients that you have. Typically older, but you're seeing some younger ones too.
Yep, my youngest patient is 13, but on average it's anywhere from 55 to 65. My oldest patient is 91, so it does vary.
And the 13-year-old, what is he or she coming in for?
She has chronic pain. She has a unique condition, and her doctor actually referred her to us for acupuncture.
Okay, and at what point should someone, consider acupuncture?
The sooner the better.
Really?
The longer you have an issue, the longer it takes to go away. Generally, if you have a problem and it doesn't go away after a couple of weeks, it's time to have it looked at.
Okay, and is there ever any emotional side effects?
Sometimes people will have what might be an emotional release. Again, very temporary, lasts maybe a day. If you can go home and rest and take a nap, that's great. That'll help it pass through. But it's usually something that's bottled up and needs to come out. And I've really never had anybody be upset about it. They say, gosh, I really needed that. So it's usually a positive thing in the end.
Okay, well, it sounds very interesting. Thank you so much for your time.
Thank you for having me.
All right.